welcome back to Midwest Access. I'm so excited to have you here,
Thank
Dr.
you.
Katie Post. It's always so fun, and I just want to chat with you the entire time.
Yay!
So, you know, Nick just had a little baby girl.
Oh, congratulations.
Yes, a little baby girl. And so I thought maybe we'd ask a little bit about newborns' teeth, little kids. Where do you go? You know, when you're a new parent, you're like,
100%, and there's so much to know about it.
Yes.
And so one of my favorite things is from the very first day that you bring them home, is I recommend using like a little, they have a little plastic rubber toothbrush that fits on your finger.
Okay.
Or you can just take a really soft baby washcloth, put it on your finger, and I had a changing table with my 3 kids.
Yes.
So when I would change them and get them out of their jammies into their clothes for the day, I would put my left hand over both of their arms very gently, and then I would put my finger and I would brush their gums and sing the ABCs. Really? So they get used to your hand in their mouth, and they get used to the ABCs. And then I would just keep that little rubber toothbrush right on their changing table with their stuff. And then at night, we do the ABCs again. So the 2 things, one, they learn the ABCs.
Yes.
Super important, and there's all kinds of research behind them knowing their ABCs when they start kindergarten.
Yes.
But 2, they get used to you brushing your teeth. I can't tell you how many parents come to me, their kids are 2 or 3, and they're like, we can't brush their teeth at home. If you start from day 1, it creates that habit of this is what we do and this is how we do it. You don't need toothpaste, but they do need to get you in their gums and get that clean. Some kids are born, they're tongue-tied, where they have a little attachment and it makes it hard for them to latch on to breastfeed. So you can easily have a dentist clip that.
Really?
And that will make it easier. It'll make it easier for talking when they're older. So some older kids, we do it for speech issues. And so that's one of those early trick things that the dentist, if you take them in, when they do the exam, they may recognize or be able to let you know. The most common one is up between, I call it the Madonna, you know, because Madonna has that big space between her 2 front teeth, and that's from a little attachment that she has on her upper lip. And that can be clipped, and that can help prevent that so that those teeth can come together. I was a huge proponent of breast milk. I think there's so many fabulous things about it. However, there's 2 problems that people don't recognize, or I didn't recognize, and I was a dentist. One is formula has fluoride in it, which is really good for your baby teeth, because those permanent teeth are already starting to develop as soon as that child's born. And there's no formula or no fluoride in breast milk. But 2, a lot of moms, including myself, would breast milk during the evening. And so that milk or that sugar is sitting on their teeth and can potentially cause cavities. So we're talking and encouraging them, you know, if you are doing that, then we want to look at, as soon as they get 2 teeth, using fluoridated toothpaste. And the National Academy of Pediatrics now recommends fluoridated toothpaste as soon as 2 teeth come in from the very beginning.
Really?
We're no longer using the training toothpaste. And a lot of, you can still find it at Target and Walmart, and it's unfortunate. Some of them have sugar in them.
Oh, yeah, because they taste good.
They taste great.
Absolutely.
But we want to make sure they're getting that fluoride so that we can get those teeth strong, so we're not getting those cavities. We have 2- and 3-year-olds with multiple cavities. Sometimes we're doing crowns on 2-year-olds. And a lot of that goes back to, are they using a fluoridated toothpaste? Are they drinking water with fluoride? Or are they getting that milk at night? So you want to make sure that before bed, if you're giving them something, you're giving them water and not getting in that habit of, you know, giving them milk all night long and that sugar that's sitting on the teeth. And one of the things you can do is, if you are going to feed them during the night, is just take a little washcloth with your finger on it and wipe the teeth off to clean it off. That's a great way to neutralize it and get some of that sugar out, so it's not sitting on the teeth. You know, so there's workarounds with all of that. The other thing the American Academy of Pediatrics recommend that most people don't recognize is we want you to start flossing as soon as they have 2 teeth.
Really?
Now, whoever made this policy maybe never had kids.
Possibly.
Because they're very wiggly. And one of the things that I found that worked for that is, once they were a toddler, and same way with brushing their teeth, is if you sit them on your left leg, and I would wrap my arm around and hold their right hand so they can't reach up and grab. And then I was able to use those little floss sticks. And get in there and floss easily. And again, I would sing some song, you know, and just
make it fun.
Yeah, I sing out of tune, so I don't know how fun that is, but I try.
It's mom. It's always going to be good.
Exactly, and they love being held and cuddled.
And I love that too.
Yes, yes. So one of my favorite toothpaste for those little kiddos with fluoride is the Tom's of Maine with fluoride.
Okay.
It doesn't have any of the sodium lauryl sulfate in it.
Sure,
so
that bubbly
stuff that makes them, some kids will get these little sores in their mouth from too much of that.
Really?
So that's a really great toothpaste for that. Crest makes a grape flavored toothpaste for kids.
Nice.
Kids like a lot. It has fluoride in it as well. So there's a whole bunch out there that are fun to try.
Ask you.
Yes.
And bring that little guy in when they have 2 teeth. Would that be
as soon as it's 6 months or older? Well, we'll see them at infancy if the parents need, or we'll consult and kind of do that.
Okay.
But yeah. So, but really, we want to see them by 1 year, no matter what. At Northwest Dental Group, we have 3 locations.
Yes.
We have one on 37th Street, one on Superior Drive, and one in Byron.
So easy to get to.
Yep.
And you've always got room for appointments.
Yes.
You continually work very hard on that. And so you can see all of our Tooth Talk segments on our Midwest Access website, KTTC, and then go to Midwest Access and under Tooth Talk, and you can see all of these different things that we talk about. Thank you so much, Dr. Katie. Love having you. All right, we'll be back with more Midwest Access after this.